Welcome. Welcome to the future of oral health care, or as we like to call it, Preventistry. I'm your host, Liz Walker, and we'd like to welcome those of you here with me, those of you who are watching online, and a special welcome to those of you who are watching on bostonglobe.com. Thank you for being with us. Preventistry is all about making oral health care more affordable and more accessible for everyone. It's a theme we're going to hear a lot about in the next 30 minutes. We've got some news to share with you. We've got an interesting discussion and some special guests as well. So let's get started by learning a little bit about our first two guests.
Stephen Pollack is the President and Chief Executive Officer at DentaQuest. He has led company growth to over 27 million members in 30 states. He lives in Concord, Massachusetts with his wife and 2 children and enjoys golfing, skiing, and the Green Bay Packers.
Welcome.
Allyson Corcoran is the president of the DentaQuest Foundation and Institute. She also serves as DentaQuest Chief Marketing Officer. Born in Tokyo, Japan, she now lives in Milton, Massachusetts with her husband, 4 children, and 2 dogs.
Thank you. Have a seat, both of you. Welcome to both of you. I'm looking forward to learning a lot more about oral health care in the next 30 minutes. So let's get started. Steve, tell us more about DentaQuest and what you're planning to achieve.
DentaQuest is an oral health company. We have 3 distinct groups. We have a benefits business that serves 27 million members, most of which are Medicaid recipients. We also have 85 care practices that are in some of the most challenging areas in the United States. And finally, we have a group called The Partnership. It's a nonprofit that invests in advocacy, innovation, science around improving oral health. Those 3 groups all have one very important purpose, and that's to improve the oral health of all. And Liz, it's a big challenge because the oral health system today is broken, but we feel we have a really important solution. We call it Preventistry.
Now tell me a little bit more about this Preventistry.
Well, Preventistry is a simple idea. It's the idea that we can stop problems before they start. And if we do that, we're going to get a better outcome at a lower cost. We're going to make care more affordable, more accessible, and everybody will have a fair shot at oral health. It's a simple idea, but it requires really big changes, a revolution. And we're leading the way in making those changes. So in our benefits business, for example, we're realigning care and finance to pay caregivers not just for fixing problems, but also for preventing them. So that's a unique approach. In Oregon, we do it through something called an accountable care organization. And that's really dentists and insurers working together around prevention. We also work in Texas, in New York, and several other states on something called value-based care. Again, same idea. Paying for prevention, not only for fixing problems. The results in those programs have been very impressive. We're very excited to tell that story to as many different stakeholders as we can over the coming years. That said, not enough. We need to do more. We know that there are many areas where there just aren't caregivers. Those are called dental deserts. So we need to get care to those areas. And we're going to lead the way. And I'm very pleased to announce that we'll be doubling the size of our care practices.
Wow, that's great.
Over the next several years, we're going to make sure that people who don't have a great care option today have more. And that will help make sure that everybody has a fair shot. And then finally, we're going to be working to change policy to align to prevention. And if we can do those things, then we're going to get one step closer to improving the oral health of all.
That sounds wonderful. Thanks, Steve. Allyson, can you tell us more about the kind of investments and philanthropies that DentaQuest involves?
Sure. Thanks, Liz. At DentaQuest, we call ourselves a double bottom line company, where really business results and social impact go hand in hand. And in fact, our parent company is a not-for-profit. And so everything we do is driven towards our mission of improving the oral health of all. And today, I am really proud and pleased to be announcing that in 2019, we'll be investing $20 million to drive. So $20 million to drive systems change towards improving the oral health of all.
$20 million, that's a lot of money, and that sounds great. What kind of initiatives are you going to be funding?
Happy to tell you a little bit about that. The first one we're going to talk about is a network that's currently called the Open Network, Oral Health Progress and Equity Network. It was formerly known as Oral Health 2020. And that is a group of 1,400 people and organizations in every single state across the country who are united in trying to change the system. So we've been a longtime supporter and partner and active piece of this network, and we're going to continue that in 2019 as well. Second one that we might want to highlight today is investing in different types of delivery of care. So we're constantly sort of exploring and funding pilots that are addressing a new or different way to help people improve their health. The one I want to talk about right now is in South Carolina, where we're integrating medical and dental through telehealth, where people, as they're at their dentist in the dental chair, will actually be able to have a medical visit. So I think it's a great step forward. The third one relative to oral health is the creation of our Value-Based Care Academy. So value-based care is a trend in overall health. It's less prevalent so far in oral health. And so we're going to launch an academy to help current providers and future providers figure out how to operate effectively in that arena. And then the last one I want to announce is happily here in Massachusetts. We've agreed and are delighted to be supporting RISE Massachusetts, which is a great organization really focused on eliminating the scourge of opioid addiction, and we'll be supporting that with $1 million commitment.
This is amazing. Great. That is wonderful. You guys are doing a lot of work, and thank you both.
Well, thank you.
Thank you.
You know, oral health is something that a lot of us take for granted as part of our insurance. But for those who are without, it can lead to a host of health issues. The numbers are shocking. DentaQuest aims to do something about that. Take a look.
There are a number of challenges with today's oral health care system. Number one, oral health is siloed from the rest of the healthcare environment. And what that has led to is a system where many people across this country, many who look like me, many who live in rural areas, don't actually have access to care.
There are barriers for those that don't have necessarily transportation, flexibility with their jobs, and it all comes back to money. Unless you have some type of coverage, it is simply not affordable.
Oral health is intimately connected to your systemic health, and if you're well in your mouth, very often that positions you well for the rest of your life.
The financial model is upside down, right? Dentists are rewarded for the amount of work they do. They're not often enough rewarded for the health of their patients.
And that system's broken. Millions of people are being left behind. And we believe that everybody can get a fair shot at oral health if we focus on prevention. That the idea that we're going to prevent the problem before it occurs will lead to better outcomes for millions of people. And we call that revolution Preventistry. And we're leading the way.
Preventistry could be an industry really focused on creating good health, using the power of data, using the power of novel science, and using our understanding of the disease process to keep people well, meaning that we can predict it, we can immunize against disease, we can screen for it, and then we could manage it better.
We are committed to working with organizations around the country who are really emphatic about improving health, not just oral health, but improving health.
We have national reach. We have relationships with 25 million consumers, tens of thousands of providers, policymakers, oral health stakeholders of various kinds. That gives us the position to make the types of changes that will make a more accessible, equitable, and better oral health system.
We're better positioned than anybody because we're already doing it. We're already paying providers to prevent problems before they actually happen. We're making investments in our technology to make it easier for our customers to access appropriate oral health. And we're working to make change to policies that, again, are around prevention.
We want everyone to have the opportunity to lasting oral health, and that's regardless of age or race or where you happen to live. It is the basis for all of the work that we do.
We need to make some fundamental changes to the system, and that's really what DentaQuest does. And that's why we're so excited about the future.
That was a great preview and an overview of what Preventistry is all about. It's really a national issue, but steps are being taken at the state level to help initiate change. And that leads to our next discussion. We have three special guests who are going to talk about what states are doing on oral health and how they can all play their part in helping Preventistry succeed. So let's learn a little bit about our guests.
Darrin Gordon is the president and CEO of Gordon & Associates. He has over 22 years of experience in Medicaid and is the former president of the National Association of Medicaid Directors. He lives in Nashville, Tennessee with his wife and 2 daughters and has a son who lives in Portland, Oregon.
Darrin.
Kitt Singhavi is the executive director of the Texas Health Institute and oversees all Texas Health Institute initiatives. He lives in Austin, Texas with his wife and enjoys playing cricket and holiday trips with his family. James Roosevelt Jr. is a consultant and advisor for Tufts Associated Health Plans. He is the former president and CEO of Tufts Health Plan. His passions include public policy and politics. He lives in Cambridge, Massachusetts with his wife Ann.
Thank you for joining us. Jim, let's start with you. Massachusetts, as we know, led the way in national health care reform. Now it's taking the lead in bringing a value-based approach to Medicaid. What lessons can we learn for oral health care in that?
So you're right, Liz. Massachusetts started doing health care reform over 10 years ago. And we now have over 98% of adults and over 99% of children covered for their physical health except for oral health. And the need to cover the whole person is so obvious. So what Massachusetts has done this year is move all of our what we call Mass Health, which is Medicaid here in Massachusetts, to an accountable care organization structure, which focuses on paying for prevention and paying for the value-based outcomes and the wellness of the Mass Health population. So there's a model, but it does not yet include a comprehensive approach to oral health.
Darrin, how do you see the benefits of a value-based approach? And what did you learn from your time as Medicaid commissioner in Tennessee?
So across the country, we've all recognized that the prior payment systems that are out there have been insufficient in rewarding the positive outcomes that we would all hope for, including all the providers that are involved in the care. And as we've all made this shift, as Jim was talking about, and thinking about the importance of whole person care and person-centered design, that we have to think about how do we reward people at getting ahead of some of these illnesses and helping people on their journey to wellness instead of being reactive. And the current system rewards a very reactive mindset. And so we, as other states are starting on this journey as well, had decided we need to help reward and incentivize providers that will initiate further up the treatment approach in order to help that individual stay healthy in the first place. And as we do that, we've seen some pretty good results. We've done this across multiple products of ours, but oral health being one of those. And I'm happy to announce that when we did so, we saw not only improvements in our quality outcomes as we had hoped, we actually saw increased utilization, and at the same time, our costs came down. So that allowed us to invest money back into those communities for other needs that were helping individuals on their healthcare journey. So this has been critical in moving us to a point to where we can help the people we serve in Medicaid.
That's amazing. Ankit, what kind of innovations are we seeing in Texas in terms of developing new approaches to oral health care?
Sure. So let me begin with sharing. In Texas, we have almost a quarter of our population that does not have access to health insurance. So that itself indicates the complex problem and the deep needs that we have in our state. And the way I view it is an ideal opportunity for us to be innovative and implement out-of-the-box solutions. Traditional approaches are not going to work. If they were to work, we wouldn't be where we are as a system today. And as a public health institute in Texas, the way we view and understand or address the issue of oral health is from the larger public healthcare perspective, and consider it as a systems issue. Moving nationally with the efforts around healthcare reform and the shift towards a value-based integrated care model, I think the opportunity and the timing is ideal for us to not only have this conversation, but work towards that solution. A couple of weeks ago, we just released a report on where we were studying hospital utilization for treatment of non-traumatic dental conditions in Texas hospitals. And what we saw in 2016 alone was over 4,700 admissions for treating these conditions in the hospital setting and costing more than $215 million. That's enormous. And when I say non-traumatic dental conditions, these are conditions that are preventable to begin with. And when we fail to prevent them, they still do not require treatment in any setting outside of the clinical dental practice. But we are treating them in the hospital settings. And the findings are enormous, and they speak for themselves as far as the value proposition is concerned to the larger healthcare conversation. And I think we are already seeing some benefits of this in Texas, and it's helping us strategically move the needle on oral health in Texas.
Oh, wow. Now let's ask this of all three of you. How important is it to fold the oral health discussion into the overall health discussion?
Well, Liz, you had some very interesting numbers on the screen a little earlier about how physical health is related to people's oral health. And we have this, it's really a historical anomaly, a glitch, that oral health and physical health have not been considered together. Now we have real data on how important that is to bring them together, and it's reflected in the insurance coverage and access system where people have different paths. Bringing those paths together has great promise for improving the overall well-being of people.
Yes, and a lot of the policies historically in states have really been very isolated and siloed off into discrete needs of individuals. So it's been more based on the design of an organization versus the needs of an individual. And so as Jim points out, as we look and more data has been available, we have seen where we have fallen short. And so bringing these together, looking at the needs of the individual holistically and making programs wrap around those individuals are critical. And we've seen great success in moving in that direction.
Ankit, what are the policy changes or new approaches that you think the states should be adopting?
So I want to reemphasize that it's not about creating a new system. It's about identifying and addressing the inefficiencies in the current system. The problem and the solutions are there right in front of us. And I think so efforts that help us move away from talking separately about oral health, physical health, behavioral health, to one that talks about whole health, the holistic approach, is essential. And what we are going to see is it's not only going to translate into savings in the short-term perspective, but also long-term cost savings in the way it also positively, or good oral health would positively impact other health conditions, which we just saw some statistics about, diabetes and heart diseases, which are also our biggest cost drivers as far as the healthcare expenditure is concerned. So it's that overall value and not just the cost savings. And when we move towards that system or that culture, what we are going to do is bring other mainstream, other measures into more of the mainstream discussion. For example, the health-related quality of life years, which is a measure used in health economics, but the current system does not allow us to talk and understand the implications in the current environment. So I think that shift is going to help us bring that more mainstream and help us bridge the connection between oral health and economic growth. And as we get there, what we are going to see is that translates into more stronger, more vibrant, and thriving communities. And I think it's that vision that we should all collectively pursue, and I feel Preventistry is a positive step in that direction.
Great. Jim, final question to you for this segment. Why is value-based care the solution to improving oral health care?
So it's very similar to the way we've learned to think about physical health. Instead of paying for one-off treatments after people get sick, look at how you can keep them well. That's why it's called Preventistry. It's to prevent getting into oral health problems, just like we want to prevent people from getting into physical health problems. So looking at that as an overall comprehensive solution provides the right incentives and then the right care.
Okay. Thank you. This was great. Thank you very much. Applause for these guys. We can learn a lot about improving oral health care nationally by watching what states are doing. So we took a closer look at the state of Oregon, where DentaQuest is bringing oral health care to the people who need it most. And sometimes that means providing care outside the typical office setting.
If we were to think about an individual living in poverty, they don't have the working, reliable car. They don't have the gas money. So every day they're working to be able to get their basic needs met. So scheduling a dental appointment is just difficult sometimes. So we want them to make an appointment, keep an appointment, show up for an appointment, fill out 8 pages of paperwork. We have all of these things that we want them to do that really overwhelms them. So what we really need to do is help to break it down. And one of the ways that we have been able to help do that is to take away those scheduling pieces by going into the community and reaching out to them where they are.
A dental clinic is really more like a hospital. It really should not be something you have to go to unless you absolutely need it for treatment. And what we really need to do is to get out there on the front lines and go way upstream to pregnant women, very young children, to do the assessments and prevention there to prevent the consequences down the road.
We have educated clinicians, expanded practice dental hygienists who are going into the field. They're delivering services to people who won't or can't access care. They're providing education. They're also providing prevention and some treatment and some triage to care.
Overall, there's a lot of poverty in rural areas, sometimes as high as 30 to 32%. And historically on the Oregon Health Plan, adults for sure have not had the wide array of services available to them in preventative services. So one of the things that we did in Oregon was including adult preventative services. And many of those services we don't have to deliver in the dental office. We can deliver it in the community and then triage those patients with the greatest need to the dental office for care.
Investing in oral health, investing in prevention isn't only a feel-good initiative. This is tightly linked to a lower dollar bottom line, right? What it's going to cost the system in the long term.
We've been working to screen kids, to triage them to care, and last year out of 400 kids, we had less than 20 kids that had urgencies, which was phenomenal. Another really great example is that we went to a DHS office and screened adults. We screened 40 adults in one day. I can't see 40 adults in a dental office in a day.
We are way better off now than we were 10 years ago in Oregon. And if we keep continuing and we're able to talk about it and we're able to back it with data and stories, then I think this model could spread through the United States.
wonderful to see the improvement and progress that Oregon has made with oral health care. There's a great stat that says 40 states are working on value-based initiatives. It certainly seems like the states are leading the way towards change. And that takes us to our next discussion, our national discussion. We have some special guests to help us break down the future of oral health care. Let's meet them.
Shaun Carney is the Chief Design Officer for Philips. He leads one of the most awarded design teams in the world. He is a global citizen with 1 daughter and 2 sons. He loves cars and is the proud owner of an Austin Healey 3000. Mokuba Basava is an associate professor at the Virginia Commonwealth University School of Medicine. She is co-director of the Culture, Race, and Health Corps at VCU. She lives in Richmond, Virginia, and is an avid runner.
Thank you. And I'd like to ask DentaQuest CEO Steve Pollack to join us in this conversation. Please help me welcome Steve back to the set. Thank you all. Shaun, you can start us off with your view on key trends in healthcare right now.
Yeah, so as Philips, we're working with healthcare systems all over the world, and there are some trends that we see coming up here in the States that we also see in other places. So, of course, you have an aging population. You've got the demographic switches going on there. With that comes a rise in chronic diseases, lifestyle-related diseases. So you're seeing much more diabetes and cardiovascular disease and cancer as well. And all of these are really placing an unsustainable stress on the healthcare system as a whole. And part of the challenge, it's been talked about a number of times in the previous panels, is that today we treat the diseases. It's episodic treatment, and that's not sustainable. We really have to start thinking holistically about health. Today's system is more about sick care than health care. So if you think about a continuum of care and really starting to get ahead of that disease, we need to find new opportunities to find and identify the early indications that people are suffering from a problem. And when we do that, I think this is where Preventistry can start to really play a key role. You see your dentist, your oral hygiene provider, much more frequently than you do a regular health provider. So why not take advantage of that?
Dr. Basava, with what, in your opinion, is the biggest obstacle or the biggest challenge facing oral medicine?
Liz, I think the plain and simple truth is that the biggest challenge facing oral health is the disparities that exist. That there are far too many people in this country who are not receiving the oral health care that they need. And this includes racial and ethnic minorities, elderly, children, people in rural communities, people in underserved communities. And here's the other interesting part. In addition to that, it's also people who work 40 hours a week, but they do not have access to dental insurance. And if we think about that, all of which I just mentioned, it's a huge problem. I think as a society, we cannot afford that, and we have to address that. Now, you may wonder and you may think that, well, could it just be an individual problem? Maybe these people just don't want to take care of their dental health, right? Because sometimes we make these assumptions. Well, the truth be told, that it's not an individual issue only. Yes, we need education in the schools, education in the homes, education when they visit their primary care provider, but it's a systemic issue. It's an issue of access. It's an issue, really of that everybody deserves access to care. So I think for me, that is the biggest challenge that we're facing. And I'm excited about Preventistry and what it stands for and what it means and the shift in our thinking that it says we need to stop these problems before they get started. And the last point I'll make on this is that we've heard that oral health has everything to do with overall health. But here's the other news. Oral health also has to do with where people live, the types of supports they have in their communities, the types of food that they have access to. It's not just oral health. And I think Preventistry is a step towards saying we have to address these issues in a global way.
Steve, what are the obstacles to change?
Well, Liz, the system's broken. From a financing standpoint, we're paying to fix problems. We also have to pay for stopping those problems before they start. From a care delivery standpoint, practices open up where there's people, right? And unfortunately, there's a lot of areas that practices aren't opening up, and they need care too. So we have to create an economic model where it makes sense to bring care to those most in need. That's going to require policy changes and awareness. We really have to work with communities to make oral health a priority.
Right. So, Shaun, if we move to this more preventistry approach, how will the role of the dentist change?
As I said, I think they can play a key role in primary health care as part of an integrated network of primary physicians. So, for instance, if you're looking inside the oral cavity, there are indications there that may be able to link back to the early onset of a cardiovascular issue. Perhaps oral cancer and things obviously are there to begin with. But I think integrating the dentist into part of that primary healthcare system is absolutely key. But again, the fundamental system has to be changed in order to reward people for prevention. And not just fixing an issue that presents itself in the dentist chair.
Dr. Basava, you talked about the disparities in the care for oral health. What do you suggest as ways to address those disparities?
Yeah, I think it can seem overwhelming when you hear about these disparities, but I think there's many things that we could do. The first thing I think is that we all have to see ourselves as an agent of change. No matter where we are on the continuum of care, whether we're the patient, whether we are the provider, whether we are the community member, the decision maker in the organization, that from whatever vantage point we are, if we understand it's a systemic issue, and when it's a systemic issue, it also means that there are many inroads, there are many pathways where we can sort of work together. So I would say that we need an all-in approach, we need a team approach, we need to work outside of our sectors. To really address oral health disparities, we need to work with people who are not only oral health providers. We need to work with community organizations, with people related to nutrition, food, schools, you name it. So I think we need an all-in approach. We need to understand that it's going to take a team effort. And the other thing I would say is that for dental providers, people delivering care, we have to move outside of our offices. We have to move into communities where care is needed the most. We have to go where the need is. And I think Preventistry really sort of is that paradigm shift, that conceptual shift, that we have to address the problem at all of these levels. And it's very exciting to me. And I think it's definitely what we need to change the needle on these disparities, which are very embarrassing, and I think we could do better.
Well, we love your passion. I think we all need your passion, too. Steve, you talked about obstacles to change. Let's talk about solutions.
Well, there is a solution. As we said, we call it Preventistry. It's a simple idea. How do we stop problems before they start, get better outcomes at a lower cost, make oral health more affordable, more accessible, and give everyone a fair shot? It requires big changes. We see it as a revolution, and we are all in. We're all in Oregon, we're all in Texas, and a number of other markets where we're actually paying caregivers to prevent problems before they start. And then we're going one step further. We're actually bringing care to areas of need, doubling the number of practices we have, and then working with policymakers across the country around prevention. We know it works. The results are very impressive. But look, this is not just about DentaQuest. It's not just about the people here in the audience. This is about those millions of people who are on the outside looking in. They're being left behind, and they deserve a fair shot. And we have a chance, working with everyone, to make a difference and help people. So let's get engaged. Check us out on Preventistry.org and join the revolution.
I love that idea about revolution. Thank you all for joining us. We want to thank all our guests. Let's give them a big hand. Thank you. And we want to thank you all for watching. We've just touched the surface of this topic, and there is much more to come. Here's what we know. Oral health care is important, and it's too often overlooked. When we make oral health care a priority, it's better for our overall health. It's wonderful to hear about the efforts underway to make oral health care more accessible and more affordable so that we can all benefit. I encourage you to visit Preventistry.org to learn more about these efforts and to learn what Preventistry is all about. Thank you so much for taking the time to listen, and I hope you've learned a lot. Bye from Boston.